An anonymous writer says, learn things from those around you, enjoy life with those beside you, and don't underestimate those below you. With this thought, may I request the delegates to stand by as the dignitaries step down and the scientific session sets in. You may be seated. This is an announcement for the speakers for the sessions. Please upload the presentations in the preview room backstage as soon as possible. I hope and pray that your stay in this historic place will enrich your mind. Have a good day. May I now call upon Dr. Barney Isaac, convener of the scientific session, to take over. Dr. Barney Isaac.
So for our academic input for the next 2 days, we've divided our entire safety sessions into 8 different aspects of safety. And as we've heard, occupational health and safety is probably one of the important parts of safety of hospital. And hence, we want to kickstart with occupational health as our first session today. May I call upon the team leader for this session, Dr. Alex, who is Associate Professor in General Medicine and who is pioneering the occupational health work in our institution, to take over and lead this session.
Good morning, everybody. I'm standing in front of you on behalf of the occupational health team of Christian Medical College, Vellore. First of all, I would like to thank God for this great opportunity to represent in this safety conference. I would also like to thank the institution and the quality management itself for having given us the opportunity. Before we start our session, I would like to invite the chairpersons for our sessions. First of all, I would like to invite Dr. Bobby Joseph. He's the head of Community Medicine and Occupational Health Services, St. John's Medical College, Bangalore. And he's a great man in the area of occupational health in our country. Of course, he has to go for his son's graduation in the evening by 4:30. But I really thank him for having accepted our invitation. I would also like to invite the co-chairperson, Dr. Joe Fleming, who is our professor in clinical biochemistry. Thank you. Team, and these are the topics we are going to cover: overview and international standards by Dr. Sun, who has come all the way from Singapore, and occupational asthma by Dr. Barney Isaac, occupational dermatosis by Dr. Dinsey, and occupational hazards, chemical hazards by Dr. Vijay Kumar, efficient ergonomics by Mr. Lenny, and workplace stress by Dr. Satya.
Dr. Alex, thank you very much for inviting me here. It's my honor and privilege to be here at CMC Vellore. And before I start, for all the CMC Vellorians here, I bring you greetings from my godmother, an alumnus of the batch of 1945, Dr. Cecilia Zacharias, who studied here many, many years ago. And when she heard that I was coming to CMC, she asked me to send you her love and greetings all the way from Canada. So it's indeed a pleasure for me to be here, and once again, thanks Dr. Alex for inviting me here. And with a few words from Dr. Fleming, I will then request Dr. Alex to take over.
It's my privilege to be part of this conference. I think safety is a neglected concept, and I think it should be a center stage concept, and I'm very glad that over the next 2 days, safety is going to be the concept in all our minds, that we'll leave here and we'll go back much more safety conscious. I'm glad there's people here from over 100 different hospitals, because we hope that 100 different hospitals will be a safer place because of these 2 days together. Thank you.
Okay. Let me move on to the first topic, overview of occupational health. Before I would like to start my topic, I would like to ask you a question. Today you are all looking very happy and cheerful. You know why? It's not because you are attending the first national conference. It's because you are out of work, out of your regular work. So you know how work influences your physical and mental well-being. So in this next 15 to 20 minutes, we are going to talk about occupational health and its importance. As professionals, medical professionals, we take care of patients, but we never take care of ourselves. Occupational health has been talked about several centuries ago, even before Christ. This is what King Solomon, who is one of the greatest kings in the Bible, said about work. There is nothing better than for people to enjoy their work, because that is their reward. As a king, he can tell whatever he wants, but only we are working, so we know the pain. But in this whole next 15 minutes, I would like to emphasize the point how we can enjoy our work. So this is the scope of my presentation. And what is occupational health and what is occupational disease? Do hazards exist in hospitals? Why is it neglected? What is the current situation, and how do we go forward? So without mentioning this person's name, it's, occupational medicine is not complete. He is an Italian physician, Ramazzini, who, his only work is observing other people's work. And he put up a book, how people suffer from work, how they develop diseases due to their work. And this is the definition for occupational health given by ILO and WHO, the promotion and maintenance of highest degree of physical, mental, and social well-being of all workers. And this is the definition of occupational diseases. There are two definitions, but basically what this means is any disease arises from the workplace. But the important thing which you notice it's not only the substances, but even the dangerous process. What is a hazard? A hazard is a source or situation which puts you in danger to your health and to the environment, or both. So one thing you should remember is it's a source or a situation. And these are the 5 major hazards. Probably through the whole conference, people will be talking about this. And physical hazards is radiation, fire, temperature, noise, vibration, and so on. Chemicals, all your gases, anesthetics, and so on. Biological, of course, we all know infections, but even animal bites, like monkey bites in our place here. Ergonomics deals with posture and all your, pulling, pushing, and things like that. And psychosocial, of course, deals with the stress, even shift work. And my teammate Dr. Satya will be talking about it later. So, one question, can you name any one place in your hospital which is hazard-free? Please answer me at the end of my session. What is the risk? This is a likelihood of getting a disease or injury because of the hazard. And another question, are you risk-free as a hospital employee? So now what I'm trying to convince is there is a relationship between work and disease and vice versa. So the rationale is we are a 24-hour working society, and we know no workplace in the world is hazard-free. That means we are all exposed to hazards, even in the hospitals. If you are exposed to hazards, you are prone to develop adverse health effects. And if you are prone to develop adverse effects, it could be either occupational or work-related. What's the difference? Occupational means occupation is the cause, whereas work-related is, for example, latex from the gloves. You get allergy. That's an occupational disease. Whereas stress, you can be stressed even at home. So work can be a contributory factor, but that's not the only cause. So occupation is also one of the causes. So if in an institution or an organization, if you are working with all these kinds of adverse health effects, you are dealing with sick workforce. And the sick workforce can affect an institution in two ways. One is people take sick leave often, And there, if they continue to work, their sickness can prolong. Because of that, there will be poor performance. On the other hand, there's a poor safety. You are not safe to yourself. If you have chickenpox or tuberculosis and continue to work, you are not safe to yourself, you are not safe to your colleagues, and you are not safe to the public. So ultimately, we are dealing with a substandard or poor productivity. Of course, it ends up with poor economic outcome also. So extrapolate to our hospital situation. If you're a hospital nurse, if you're allergic to latex, you can tend to develop occupational skin diseases or asthma. If you're a hospital surgeon, prolonged standing, bending, and finally can develop neck pain, back pain, stress, and so on. So we are dealing with a sick force and poor quality we are giving. So what's our goal? We have to engage healthy workers and good management system. So you have a enhanced productivity, ultimately better economic performance. What are the scientific evidences? These are some of the studies which I could take, and there are a lot of studies, but I could take, I could highlight few studies. Of course, you all know about needle stick injuries. I'm not going into that. But if you take shift work, there's one study, there are around 16 to the meta-analysis among nurses. They perceived poor general health, increased injury rates, increased weight gain, and alcohol abuse. In another study, it's an important study, the breast cancer. Incidence of breast cancer among the hospital nurses increased. If you see the confidence interval, it crosses 1. I'm not scaring you, so don't go back and tell your people and say that, I'm not going to do shift work, you will be thrown away. But what I'm trying to say is we have to take care of ourselves, but there are certain principles to follow to take care of ourselves, and my subsequent speakers will be dealing with all those things. So what are the other evidences about musculoskeletal disorders? Here is one study which shows, it's in Switzerland, and it is a longitudinal study which shows the prevalence of low back pain was 73 to 76% in the 8 years period. And there are a lot of studies. So there are scientific evidences to show that there is a link between work and health in the hospitals. So what is the current scenario? So most of the time, it is therapeutic. We develop a disease and then go. So it's a kind of tertiary care, tertiary prevention. And it's a patient initiative. We go ourselves. Because of that, there is loss of work hours, recurrent cost, and definitely there is a health system burden, and ultimately, and some of the people will have residual effect due to the disease. So why? Why? Because we think we know everything. Because healers ignores their own health. We don't take care of ourselves because we think that we can take care of ourselves, and we consider ourselves as a low risk group. But it's actually not. And lack of awareness. We don't know which are the hazardous things in our surroundings. Lack of priority. For us, the priority is mostly something else, not our own health. There are a lot of things to do. Lack of scientific is an important aspect. It's very difficult to prove which came first, like a chicken or egg, because you cannot do randomized control trials in this area, because you cannot randomize people to expose to a hazard. It's ethically wrong. So it's all longitudinal or case control studies, so the power of the studies are not adequate to prove the link. And less attention to certain hazards, especially in the hospitals. We concentrate more on the biological hazard, but there are a lot of ergonomical hazards which has been neglected in hospitals. Less attention to certain groups, probably people at the higher level. There may be a difference in care between higher level and lower level, and lack of support from the administration, and contract and part-time workers. For example, people like this, working inside our own campus. So what are we doing with that? So what is the way forward? It is the primary and secondary care prevention. How do you do that? And what are the principles of prevention? There are three aspects to that. One is selection of, when you select itself, you select appropriate people, and retention. And second is surveillance, and it's both biological and environmental. And third, if you get any hazards, you have to have control measures. And for that, you need to have a good occupational health and safety service. How this can function in your hospital? So, this occupational health and safety service, what are the functionings? First, you select. You need to have proper protocol and guidelines for pre-medical checkup and the vaccination. We need to have written guidelines for all these things. And once you select, it's our responsibility for their health. So the health protection and health promotion. So in the health protection side, if you want to protect their health, we need to constantly monitor them in both ways, biological and environmental. If you say biological, it is two things, clinical and non-clinical. Clinically, probably you need periodic health checkups for them. You have written policies, you should have written policies about that, and which are the risk groups, and what are the tests we need to do. And the other thing, non-clinical is absenteeism is an important issue. We need to concentrate on this aspect also. Why this is happening? Is it because of the persistent sickness, or because of anything else? Why this person is absent? Then we need to have an evaluation program, and we need to have appropriate control measures for that. On the other side, environmental. This is a safety department has a major role in this aspect. What are the hazards? These 5 hazards, this particular team should work on this 5 major hazards. They identify the hazards and a risk assessment. I will just tell you briefly how to do a risk assessment. And then you have appropriate control measures and reporting. One thing I forgot to mention here is we have to communicate this to the employee also. And on the health promotion side, we need to have education programs, promotion programs, and need to have policies, counseling centers. And my friend Dr. Sun will explain you in Singapore what are the ways they are doing all these things. And of course, there are other services which can provide through this service or confidential discussions and travel vaccine policies. All right, how do you do risk assessment? Step 1, you know the consequences. Okay, exposure to this particular hazard, for example, radiation. If you are exposed to this particular hazard, what will it happen to the employee? Will it cause death? Will it cause minor injuries? Will it need any hospital admission or an outpatient management? So the consequence we need to figure out. Second, the likelihoodness, whether it's more likely or less likely, and then you calculate. And this is the matrix, and how to do that, the consequences and likelihood. So major, moderate, minor, and insignificant, and this side you can put more likely, less likely, and moderate. And then you put it like that. If it is extreme and high, you need to control immediately within 24 hours. And suppose if it is medium level risk, you need to have a low-cost control measures. Probably you can wait for some time. But of course, low and negligible, you have to monitor properly, but you don't need necessary action immediately. So what are the control of hazards? This is the hierarchy. For example, in any machine in a hospital is very noisy, and if the employee is coming and complaining you, what we do? What's the advice we give? We give them an earmuff or earplug, because that is the cheapest. But actually, we have to, this is the hierarchy control we need to follow. If mercury is a problem, we have to eliminate, or we have to substitute with something else like electronic apparatus. But that's the hierarchy. And engineering, we need to have proper ventilation systems, or if the ammunition is very noisy, you need to have barrier methods to do that. That's engineering. Administrative control, you rotate the person or you transfer the person depending upon the exposure levels. And finally, only the personal protective equipments. But most of the time, this PPE gets priority because that is cheaper But if you give more importance to the personal protective equipments, this is what will happen. Okay, the helmet is hanging somewhere else. So unless you monitor, this is what will happen. So these are some of the scientific evidences. If you have a good system, what will happen? There is increased occupational health and safety implementation over time, improved employee perceptions of the physical working environment and the psychosocial environment, and the workers' participation. And it also decreases the lost time injury rates and increases the workplace productivity. And this is another study done in the US. Around 2,500 employees, but they are all office-based. And these are and they had a health and well-being system in place, and these are the result. Outcome over 2 years, 12% reduction in the staff absence, 25% reduction in the staff turnover, and increased employee engagement and commitment. So to conclude, occupational is greatly neglected among healthcare workers, and definitely it affects directly or indirectly our health, and creating awareness among the hospital staff is important. Prevention, primary prevention is the key, and the hierarchy of control measures should be followed. It's not the PPE, but we have to go through the hierarchy of control measures. And establishing an occupational health service in your hospitals is important to address the employees' health. Thank you. But you can, if you have the answers, you can tell me later.
We're supposed to have a slide introducing each of our speakers, and I'm sorry we could not introduce Dr. Alex. I must apologize for that. And Dr. Alex is an associate professor in Christian Medical College, Vellore. After doing his general medicine, he went to Singapore and did his occupational medicine from there, and has returned to lead the occupational health services in CMC Vellore.